Hi, good evening. My name is Olivia, and I will be doing an education about your diagnosis and how to live with this disease. Can you confirm your name and date of birth? Patient 1, Eleanor West, January 2nd, 1978. I scanned the ID. Okay, it is confirmed you are Eleanor West. What do you know about HIV and or AIDS? So patient 1 will say, I know it is a death sentence and it's scary to have it in this day and age. I can understand why this is scary for you. Let me explain everything to you so we can see how to tackle this diagnosis. HIV is the condition where the virus is attacking our immunity system and makes it weaker so our body is not able to fight off infections. The virus compromises our defense system by attacking our cells that fight off other agents that causes infections. AIDS is when the HIV is left untreated due to noncompliance to the treatment of HIV, or so much damage occurred from HIV and has not properly responded to the treatments. HIV/AIDS is transmitted through blood, which means it can be acquired by sharing needles, sexual contact, or childbirth. So patient 1 will ask, how does HIV/AIDS make me sick? The viruses that cause HIV is called HIV-1 and HIV-2. As mentioned, they compromise our defense system by attacking our cells that protect us, which are the white blood cells. A type of white blood cell that is particularly attacked are the CD4, aka the helper T cells. When these types of cells are attacked or damaged, we feel flu-like symptoms, swelling on our lymph nodes, or can get rash. So patient 1 will ask, is there a way to stop the progression of this disease? There are medications that can treat and stop the progression of HIV. During this treatment, you will be prescribed antiretroviral medications. These medications work by stopping the virus from replicating themselves and making our immunity system weaker. They cannot cure the disease, but will allow you to live longer. When you are on the antiretroviral regimen, you may also need to do labs to detect your CD4 count to ensure the medications are working. So is there a way I can still live with this disease? The patient 1 will ask. Yes, it is possible. You mentioned that you know HIV/AIDS is a death sentence. However, people can still live daily lives with HIV if they are compliant with their medication regimen. There are about 1.2 million people in the United States living with HIV. Do you have any questions to anything we talked about? What do you understand so far about this teaching? So patient 1 will ask, I know HIV is caused by a virus that weakens my white blood cells, and I got it through blood or sexual contact. If I want to stop the disease from progressing into AIDS, I will take my medications as prescribed. Correct. Here are pamphlets we discussed during this visit. Please contact a doctor's office if you have any more questions we can go over. It is important to help you treat the disease. All right, that's my presentation. Thank you very much. Have a good night.